Good morning, magandang umaga po sa inyo lahat. This is another great day for us to celebrate life and also at the same time learn from this particular page. So this is Dental Marketing Philippines, but today is going to be very special because we are now going to talk to a medical doctor. Okay, so you are all excited. I'm sure we are excited also to hear about telemedicine. So what is this telemedicine? But before we proceed with that, while we wait for some of the viewers for them to tune in, I would just like to make mention that dental marketing. So, what is dental marketing? Dental marketing is an avenue. We are also a community of wherein we give you tools, social media like website. Also, we bring you chatbots or artificial intelligence and lectures and seminars. And this is what we actually bring to the table. No? And for just the information of everybody, we have had run several Dental Marketing Philippines lectures. We also do interview. The first one, we're very fortunate to have interviewed Dr. Stephen B. Almonte. He was able to discuss the Philippine Dental Association program and the topic actually at work, leadership in time of crisis. So we're able to discuss also the programs of Philippine Dental Association for your consumption. And also, last April 10, I was able to discuss the topic is pandemic, its effect to your dental practice and dental business. I would like also again to make mention, maraming salamat po sa nag-tune in and we're able to get a lot of feeds. Thank you very much and we will be continuously giving you information, especially with this webinar. As I've said, this is we are going to continue this until the ACQ have been or we have flattened the curve. Okay, so that is actually our second one, and on the 16th, no, except today, that's going to be tomorrow. We're going to have another one. So this is a scientific lecture. It will be given to us by no other than Dr. Matthew Gillespie, directly from Houston, Texas, USA. And the topic is an alternative approach to the traditional dental model using minimally invasive biomimetic restorative dentistry to build a value-based dental practice. Again, I am Ruiz, and I'm the founder of Dental Marketing Philippines. And my duty and my responsibility at the same time, I feel like that's also a responsibility while we are in this enhanced community quarantine, is to give you more information about your practice, about the community, what's really happening in our localities and even around the world. And with regards to another seminar that will be happening on 17th. So this is a good friend of mine. I met this beautiful lady in Boston, Massachusetts, when we had dental marketing lectures there, and she is Sonia Dunbar, and she is going to talk about the untold stories of establishing a successful geriatric mobile dental program. Alam nyo, mobile dental program is basically new in this industry, and we're excited that she was able to say yes to our invitation, and because of that, we're very excited. Okay, so let us see, and on the 18th, again, it is my duty to bring you a very good lecture, and this lecture is all about Dental Marketing Philippines, bleaching. So everything about bleaching, the whitening materials, cases, in some technical specifications. I was able to invite the CEO or the president of Glovodent USA, and he is Mr. Arturo Pabia. He is the exclusive distributor in the whole world of this, what we call the whitening blunt press, that is very much available to the whole world for us to really take a chance in terms of using these whitening tools. Okay, so right now we are very lucky because the topic today is, what do we need today? Boost or telemedicine. So telemedicine is the topic today, and as again I said, we are very fortunate because he's already online, he's already there. We're going to have him in just probably 1 or 2 minutes. Just allow me to continue this kind of presentation. I would just like to make a little review, a very brief review of our presentation last April 10, I did the pandemic. Now, let's see what will happen to your business. Sinasabi ko nga po, no patient, no income, not even consultations, wala rin po. But ito nga po, this is what I don't want you to look into as a professionals, because you will definitely have you will definitely be professionals until your last breath, looking for some other businesses. Again, as a dentist, today's topic is all about medicine, but I just discussed with you last time that exposure to diseases when you are a dentist is 95%, and physical proximity, this dentist is too close, as you can see in the picture, so it's 99%. Then we have a pandemic effect to your dental profession and dental business. Nakita niyo po, I did also a presentation about teledentistry. Now your Philippine Dental Association have arranged 7 organizations about teledentistry, and right now we're going to talk about telemedicine. So without further ado, I would just like to say hi to our guest. Our guest is Dr. Luisito L. Ruiz. He has a master's degree in hospital management. He used to be the PMA, Philippine Medical Association governor. I think he's been there for 2 terms, and he also a previous former hospital director of several hospitals, and also a visiting consultant of several hospitals or institutions or medical centers. And we're just very lucky to have him. We're going to ask him several questions, but he will be talking first about telemedicine. So for those who are watching right now, definitely you can ask question. You can PM us, or you can get into the dental marketing chat room, and we will be able to provide you more information. So by this time, allow me to just say hi to Dr. Ruiz and maybe talk something about himself. Good morning, Dr. Ruiz. How are you?
Good morning, Mr. Roger.
Yeah, so it is a pleasure that you are with us today for Dental Marketing Page. I know the page is Dental Marketing, but we're very fortunate that you have said yes to our invitation and provide more information to our dental viewers. And of course, we do have other viewers na hindi naman mga dentist, doctor. Kamusta po? Yeah. So today we're going to talk about telemedicine, doc. Before we talk about that particular topic, I'm sure you know a lot of course, you are a medical doctor. Tell me something about yourself, doc. What do you do? Ano bang specialization mo? Doc.
Yes. I'm a general surgeon. I practice for the past 20 years. And now we're devoting myself into a primary care. After my stint a clinical manager in some other institutions. So our objective now is to establish more primary care, because this is what we need at present. More primary care and primary care centers.
Okay. So, Doc, you do have a family care center. So, where is it located? Or maybe, so close po ba yung clinic ngayon, Doc?
At present it's closed to protect us from this virus. But our colleagues and some of our doctors are working in the hospital as a frontliner.
Oh, yeah. So, okay, Doc. We have some slides. Maybe you can talk us about, then you can proceed with your presentation. Ay, sorry. Tingnan po natin yung slides dito. Ito po, Doc. So, you can now proceed with talking about this, what is telemedicine, Doc. Go ahead, Doc.
Okay. Telemedicine, it's a new and old. What do we mean by telemedicine? Can you hear me, Roche? Wala. Hello? Hello?
Go ahead, Doc. Go ahead. Go ahead.
Nadidinig niyo ba?
Yes, yes, yes.
Okay.
Okay.
Pag-usapan natin yung telemedicine. What is telemedicine? Actually, telemedicine is giving medical service to a distance. No? Ibig sabihin, we don't have face-to-face physical contact with the patient. We will be able to deliver our medical services to a distance. No? With the advancement of our information communication technology or the computer, we can do medical services even without physical or personal patient-to-patient, physician-to-patient contact. Through telemedicine, we can do some evaluation. We can also diagnose the problem. We can also treat some primary problem. And at the same time, prevention, rehabilitation, and proper referral can we can do that to telemedicine. Telemedicine actually can, because of our setup in the Philippines, sabi nga nila, we're 7,100 islands. With a doctor-patient relationship. We cannot do service, especially for the remote areas. And with this telemedicine, we can probably give some medical services to our community. So through telemedicine, we can do some medical consultation. No, we can do some remote monitoring. We can monitor you remotely without going to the hospitals or clinic, and we can also interpret remotely or analyze your laboratory or some other diagnostic modalities for you. So with this telemedicine, actually, and that will improve easy accessibility to the doctors. That will also reduce the health cost because you don't have to travel and go to these remote areas, transportation expenses, and some other expenses. No, and then it's a real time because of the advancement of our computer or Wi-Fi or computer aids. It's a real time. Ibig sabihin, andun na kagad. Andun na kagad. It's more accessible. And telemedicine per se, is actually this is about time. Actually, for this computer age or for computer more advancement in computer, it's about time that we talk about and give something like for the telemedicine to be able to pursue not only the private sector but the government should be able to pursue and invest more on this telemedicine. Yes, Roche?
Sige, Doc, diretso. So, narinig ng ating mga manonood, Doc, we have several watchers now that what you are basically, this is the time for us to really get telemedicine. I would
Yes,
like, Doc, go ahead.
Actually, sabi ko nga, new and old. Telemedicine is new and old. During the ancient times, the Greece, the Rome, they used telemedicine, but not through our cellphone computer, but through messenger. They communicate through the messenger, or even during nakita natin sa television movie. They use fire or other signals, to communicate with some other villagers. So actually, they've been using that way before. And telemedicine started in 1960. Actually, this parallel with the advancement of telecommunication. At the moment there's technology and communication, it will parallel also to the development of telemedicine. They tried that during the war time, in the calamity. They're using telemedicine. But actually, the use of modern telemedicine started on 1990. We have now advanced telecommunication, real-time, face-to-face consultation.
Yeah.
You can also have this digital stethoscope, digital thermometer, digital monitoring device, and you can also have the digital typing communication system, wherein the result of X-ray scans can be accessed through the computer.
Uh-huh. Sabi mo, Doc, kanina, you were telling us that you can analyze and you can monitor the test. Paano mangyayari doon? And then the patient will just show you the results, or the patient will just scan and send it to your PM, or ganun po ba?
Yes, actually, what we're doing now, but not on a wider scale.
Doc, sorry po sorry, I will cut you. Pero nag-e-echo daw po yung boses nyo. Medyo nag-e-echo. Pwede ba medyo tapos may background. So para po marinig na natin. Medyo layo-layo lang konti ba? Ayan. So while Dr. Ruiz is arranging his echo, because there are several viewers that suggested that they might have a very good audio because it's a very good topic and they would want to listen more very, very clearly. So Miss Amalia Portes Hermosura, Dr. Janet Rodriguez, good morning sa inyo. So we're discussing about telemedicine and Dr. Ruiz is talking about the effectivity and kung kailan nagsimula and history niyan. Then, yeah, you might want to continue, Dr. Ruiz, about the telemedicine conversation that we have before I cut you off.
Okay. Now with the advancement of it's about time that we use this technology in giving medical care to our communities. There is a patient population. Kulang ang mga workers natin, no? And the best way for us to accommodate or to do service to all the communities is to use this. At present, as I've said, digital the basic for diagnosis is available to this medicine. Although there's a limit, that's why I told them an easy access to consultation, but there's a limit. So in the telemedicine, you should also be able to know when to refer, how to refer your patient.
So Doc, the limitation is the referral system. So when you found out that there's something more that needs to be done, then that's the time you will refer after the telemedicine.
Yes, after the initial consultation and initial diagnosis. It's only the basic. But remember, the early diagnosis is the best treatment. No? Prevention is the best. So you don't need to go to the hospital to be able to diagnose.
Apo. So may nagtanong po dito, if I may cut you off with let us talk about the advantages and disadvantages of telemedicine as reflected on the slides, Doc. Then there's another request, baka daw pwede kang lumayo na konti sa laptop mo para magawa ng echo po. Pasensya na, Doc, but just for us to be able to give more clear sounds for the listeners and for those who are tuned in right now, then we just go with the request. So, Doc, take us to the advantages and some of the disadvantages of telemedicine. A lot of people here are saying that when you do have telemedicine, is the Philippines ready? Are we ready for this telemedicine, Dr. Ruiz?
Yes, number one advantage. It will be more accessible. Even to the remote. So kahit walang you can the basic medical you should be able to provide. Number two, with that of technology, there is a real face-to-face
face
communication with your
communication.
patient. No.
No.
Number two,
Number three
is
is
the
the
reduce the
reduce the
cost.
cost.
No.
No.
It will
It will
reduce the
reduce the
cost
cost
of
of
the
the
patient going to the
going to
clinic.
the clinic.
It will
It
reduce
will
the
reduce the
our
our
doctor
doctor
your power
or
plant.
power plant.
No.
No.
That is will
That is
be
will be
advantage of telemedicine.
telemedicine.
The
The
disadvantage,
disadvantage,
there's a
there's
limit.
a limited.
Uh, medicine, you need
Medicine, you
to
need to
have
have
physical
a
contact,
contact,
physical exam
examine
diagnosis.
diagnosis.
Um,
Um,
not
Not
everything can be
everything can be
provided
provided
with technology.
technology.
So
So
in
in
scenario
scenario
where
where
you
you
can
can
you can
you
have
can
this
have this
advanced
advanced
or
or
physical
physical
where you
where
need
you need
contact,
contact
physical examination.
examination.
There's a
There's a
time
time
that you
that
need
you
to
need
the
to
patient for the
for the
physical
physical
examination.
examination.
Number
Number
is
is
procedures. You can
you
approve
cannot do
procedures for the
for the
medical
medical
procedure.
procedure.
So
Uh-huh.
So
only good
only
for
good for
primary basic medical
medical
service.
service.
Okay.
Although
Although
in
in
some
some
other, just like
just like
talking
talking
about
about
robotic
robotic
surgery,
surgery,
even
even
doctor
the
100,
hundred one
if you can do
can do
surgery.
surgery.
But that is
But
a
that is a
different. That's a
that's a
different.
different.
That's a
That's a
network
network
hospitals
hospital
wherein they can
wherein they can
surgery even
be
a
even
doctor in US and
US and
doing
doing
surgery
surgery
through robot.
through robot.
So that's
So
a different.
that's a different.
But what
But
we
what
try
we try
to
to
take
take
advantage
advantage
is the
is
use
the
of
use of
for the
for the
primary.
primary.
Okay. So telemedicine is very advantageous for primary care. As you were saying, Doc, we need to be able to really understand the beauty of telemedicine, especially during the time of, especially during this time, no, Doc. So the other question is, is the Philippines ready to accept this kind of situation, this kind of telemedicine? So, as you know, that this is something that was never actually it was done or maybe never done, never really tried in our country. So the big question is, are we all ready? Patients and doctors, are you ready and are we ready for this kind of technology wherein we're not going to see you personally and you're not going to touch any part of our body for the actual feelings, something like that.
That's a
That's a uh,
2011. There's
there's
a
a
Preginet
Preginet
organization.
organization.
Uh-huh.
It's a
It's a
Philippine
Philippine
Research
Research
Education
Education
Cooperative Information Net,
Information Net.
and they
And they
are
are the one
promoting
promoting
use of
use of
telemedicine
telemedicine
for us to
for
be
us to be
able
able
to give
to give
service to
service
the
to the
areas in the
areas
country.
in the country.
Mhm.
However,
However,
it was
it
not
was not
pursued.
pursued.
No,
No,
we should have
we should have
invested uh,
uh,
this
this
technology. Our
our
problem,
problem
the
the
interconnectivity
connectivity
Wi-Fi
Wi-Fi
in some other,
some other
especially in the
especially in
country,
the country
very
very
poor.
poor.
For us
For us
to use
to
the
use the
you should
you
have
should
a
have a
interconnectivity
interconnectivity
with the
with
Uh-huh.
the
Wi-Fi.
Wi-Fi.
What
What
we're no. So
so
you really
you
have to
have
invest in this.
this.
If you don't
If
have
you don't have
to use
free use
no. So
so
it's an
it's a
investment,
and
not only
the
uh, government
government
medical
medical
services,
service
but the
but the
private
private
sector
sector
can
can
benefit also,
benefit from
and that
and
will
that
be beneficial to the
beneficial to the
community.
community.
Okay.
Now, this is
Now
what
this is what
Jeanette
Jeanette
in 2011,
2011
but you haven't
you
heard
haven't heard
anything for any
for any
infrastructure
infrastructure
developed
develop
for this
this
telemedicine.
telemedicine.
But there is
But
a
there
group
is a group
uh, in the
in the
Philippines.
Philippines.
There is
There is
other
other
group that's
that's
telemedicine, but
telemedicine
that's not
not
owned
owned
or
or
operated by
operated
the
by the
local, but
local
it was owned by other
by other
foreigners.
foreigners.
because
because
in other
other
countries, in
countries, in
advanced
advanced
countries,
countries,
they are
they are
using
using
telemedicine
telemedicine
already.
already.
So
So
that's why
that's why
I
I
suggest that
suggest
we
that
should
we should
really look
really
into
look
this.
into this.
It's
It's
about
about
time,
time,
especially
especially
on
on
this
this
pandemic or
pandemic or
quarantine period.
pandemic period.
Uh, so
So
in the
in the
Philippines,
Philippines,
there's
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 actually
actually
no
no
existing
existing
law
law
regulating
regulating
telemedicine.
telemedicine.
But
But
if we
if
will
you will
look at
look
the
at the
Medical Act
Medical Act
of
of
1959,
1959,
kasi
kasi
1950 pa
1950
yung
pa yung
law
law
regarding the
regarding the
practice of
practice of
medicine.
medicine.
It states
States
that
that
in the
in the
practice for
practice
you to
for
be
you to
able
be
to
able to
practice
practice
medicine,
medicine,
you must
you
have
must have
physical
physical
contact
contact
for
for
examination,
examination,
physical
physical
examination. Yeah.
examination. Yeah.
With
With
telemedicine,
telemedicine,
you don't
you
have
don't have
a
a
physical
physical
contact.
contact.
Uh-huh.
However,
However,
you know,
you know,
with
with
advanced
advanced
technology,
technology,
face-to-face,
face-to-face,
real-time,
real-time,
digital
digital
diagnostic
diagnostic
equipment
equipment
are
are
already
already
available.
available.
No? And
And
I think
I
it's
think
about
it's about
time for
time
us
for
to
us
be
to be
able to
able to
amend
amend
those
those
law.
laws.
Just
Just
like in the
like in the
court,
court,
before
before
uh, your
your
recorded
recorded
video
video
conversation
conversation
is not
is not
accepted in
accepted in
court.
court.
But
But
now,
now,
even the
even the
text
text
messages,
messages
and
and
some
some
recorded
recorded
videos
videos
are
are
being
being
recognized.
recognized.
So
Uh-huh.
it's
So it's
basically the
basically the
same
same.
medicine. Telemedicine
Telemedicine
being used
being
with
used
enough.
with enough.
Remember
Remember
our
our
no?
no?
During
During
the
the
consult,
consult,
they are being
being
tested
tested
in from the
from the
space to the
space to the
planet.
planet.
So it's a
So it's a
telemedicine.
telemedicine.
So
So
it's about
it's
time
about time
that we
that
should
we
take
should
advantage of this
advantage of this
technology.
technology.
Doc, if I may cut you off again, sorry, but this is really getting interesting and we're really getting a lot of feeds from our viewers. A lot of information are being actually stated by you. But there are several comments nag-e-echo, Doc. Then, inaudible yung sound, sayang yung mga information, hindi po namin maintindihan. But we are so interested. I don't know what's wrong. We'll try to continuously check it with Dr. Ruiz side. We have tried moving him back, but we have tried also to move him in. So, yan, di maintindihan Doc masyado, pero ang ganda, pero still echoing. Okay po, we will continuously try to make the specific clarity on the sound as we are really getting a lot of information about Dr. Ruiz. As he was saying po, it's on the law that you have the doctors or the physicians and the patient must physically see each other. Tama po, Doc, kanina? If I got it correct?
Yes,
Yes,
that's in the
that's
law.
in the law.
So that needs to be amended, as you were saying also.
Yes, actually,
Yes,
but
actually, but
it's
it's
no
no
clear
clear
regulations
regulations
about that.
about that.
Actually,
Actually,
in
in
2011,
2011,
they
they
studied the
studied the
framework of
framework
the
of the
system of
system of
telemedicine. But there's no
there's no
concrete
concrete
rule
rule
regarding
regarding
telemedicine.
the
And
Okay.
at present,
present
the DOH
DOH
and
and
telemedicine in the
they
NCR
are
to make it more available
available
to our community. So they don't need to go to the hospital to prevent overcrowding in the hospital. You can access the DOH line or hotline for you to be able to consult about your signs and symptoms regarding COVID. So it will decrease the number of people going to the hospital.
I have also somebody just PM me, Doc, about a lot Filipinos, or specifically basically our culture. We would want to attach, or we want to have a sort of sort of a personal relationship with our physician. We wanted really to establish that physical contact. Aside from, during this time, we cannot go physically connected with them. But how about, the on the business side of it, uh, how will they pay you when after the consultation, So that's on the other side of being ethical in doing business or ethical in terms of consultation. But doctors also needs to be able to earn that kind of money for a living, doc. So paano po yung payment niyan? Paano po ang bayaran niyan in case na ganun po ang telemedicine na mangyayari?
Okay, first, I would like to answer the issues about before we go to the patient doctor. Before telemedicine, we're using only telephone. Video are not here at that time, and there is a delay. But with this advanced technology, it's a real time. It's more clear.
Yes.
No, doctor-patient relationship, just like some the other family. People working outside of the country. You're using a video FaceTime or face-to-face through
Correct.
Twitter, and they can have this. So the question of patient-doctor relationship before can be answered with advancement of this technology. It's more real time. It's clear. No. Even you can easily access. So anytime of the day, you can access now telemedicine. If we can put up a 24/7 telemedicine clinic, that will be advantage for even some emergency consultation. So it will be more. Now your next
The business.
side. For example, regarding the pain. Now there are many options. Number one, there are some that you pay a certain amount, and you can have limited consultation to that particular. So it's something like a member. You're a member. You pay 2,500, for example, and then you will have a 24/7 access to that telemedicine, and you can also have unlimited consultation.
Wow.
For the dental practice, it will be also beneficial because with the advanced technology, the dentist see the oral card. They have an idea on what's the problem. So by the time they go to the dental clinic, they know already, and they have specific schedule already. So they can initial consultation to the so you can properly schedule your patient. You can example you can allot your to 10 for a consultation, and then afternoon the for your patient. Something like that. It's either pay one time or pay through credit or any other services.
Okay.
So there's a lot of applications. How to
Yeah. So there are several questions that already popped out during this sa ating dental marketing page. I think I have four more inquiries here about telemedicine, but I think I have received also four comments on the echo. Okay. So I don't know what's wrong. Maybe Doc, if you don't mind, I'll get back to you in 1 minute. Maybe you can, Edong can arrange that one. Then, sige.
Nilower ko na po.
Lower na. Okay.
Tinry ko lower.
Lower.
Yan. So I think you're doing okay naman, Doc. Sige, can you malina? Can we hear you again, Doc?
Hello.
Yeah. So, yeah.
Mas malinaw.
ba?
Yan, medyo malinaw, Doc. I'll be asking one more question. So what would happen to the privacy, Doc, of is it gonna be this is supposed to be online, right? Online. And when online, kailangan po naka-internet. So what about the security, Doc, in terms of the conversation? Is it gonna be recorded in the cloud? Or what will happen to the privacy of the or particular disease, to a privacy of knowing the doctor to patient relationship?
Actually, that's one in telemedicine. The privacy and confidentiality of the
Ano po ulit?
the privacy and confidentiality of the medical record. A lot of technology are being used. So, to be protected, you consult the medical. Your data recorded be safe to our medical. And it is digitally saved to our record. So basically, we have then the moment you divulge all this information to the public, the access for the doctors is liable. There's a correspondence for them. So confidentiality and privacy will be protected in medicine.
Okay, Doc. Thank you very much. And another question here. Ito nga, sabi niya, paano nga po yung billing? And then also, there's another question that I would like. How about the prescription? Is it gonna be the e-prescription na rin, Doc? When we have fully implemented all of this, siguro it will take probably a new law to pass this. And once we have a new law for telemedicine, kasama na siguro, Doc, yung pagbibil, pati yung pagprescribe ng gamot, kasi para i-honor ng mga butika. Tama po?
Yes. Telemedicine, you have e-medical consultation.
Ano, Doc?
I mean, electronic medical. You can also have e-prescription. So, digital, and you can just send it to the phone. Or the center can have and should be accredited of drugstores where all your prescriptions are recognized at drugstores. Form for that. The PR, the number.
Talagang, Doc, talagang medyo talagang nagpuputol-putol yung line. Pasensya na, but this is really getting interested. We have here. So probably I'll give you 1 minute to fix it. Edong, I already talked to Edong. So sige, Doc, ha. So I will just review. So tanggalin po muna natin si Dr. Ruiz. Inaayos niya lang po ang we have communication through our private messaging, and we are very much interested knowing all of this topic, and we have heard from him that it's really a great opportunity for us to be able to have this kind of arrangement, especially if a new law will be passed, because as he said, there is an existing law that the physical communication or direct contact or direct consultation must be done with the physician to a patient. So it's really interesting to get to know na kailangan baguhin yon, or there would be just a little amendments for us to be able to implement telemedicine, because now we are finally experienced this enhanced community quarantine, and we know for the fact this is really needed, the telemedicine. A lot of people are getting sick, but a lot of people are also afraid. Also, a lot of people are afraid to really go to a medical clinic or multi-diagnostic clinic, and somewhere the others are closed, and also afraid to go to the hospitals because there's a lot of patients that are suffering from COVID-19. So I think this is very timely, and I'm just would like to invite each and everyone for you to ask question, as we were going to bring back Dr. Ruiz in a few minutes as he arranged the audio, because they have given us more information about telemedicine. When did it start, and how really how much do we need telemedicine nowadays, especially in this time? And we know for the fact that there are several countries, third or first world countries, that are using telemedicine. If you are also watching Money Heist, so there is what they call the robotic, not actually robotic. The doctors are in Pakistan, but the patient is in Spain, and it's being operated. So it's via by using of the internet, and they'll just give more instruction. But that is far away, too much advanced. But this one, robotic surgery, as Dr. Ruiz said, as he's a general and cancer surgeon practicing in several hospitals. And as I said, he used to be the hospital director of several hospitals and medical center, and he's also some owners of some of the hospitals that are located in Metro Manila. And he has given us more information about this telemedicine. Why is it important? How is it gonna affect each and everyone? People are afraid to see doctor or even drop by clinics due to this COVID stage. So we are very much interested to get to know. But unfortunately, we cannot be able to implement this on a massive Philippine setup, as a new law is really needed for us to amend. And by the time these enhanced community quarantine are done, maybe our lawmakers will look into this and put some budget in this, especially for those government hospitals. And this is really interesting. If we can be able to keep more information, and we can be able to implement this teledentistry or telemarketing or telemedicine, I think we can be able to provide more information, be able also to provide more services to Filipino people, even those people who are not in the city. So we can even extend the services of all our frontliners, all of physicians, to those who are in the area wherein there's very hard to get there, and there is also no hospital. So that is a great advantage of this particular telemedicine. I just hope that people will try to will see and all of us should realize that this is very important. If I may say, sorry, PGH or Philippine General Hospitals, because they do have several patients, they do have a lot of COVID-19 positive patients, and they are not allowed to be visited by their their kamag-anak or family and friends. You know what they did? They have the social division created a program connected to internet, and they are allowed, given 15 to 20 minutes, they are already connected with their family. And you know the results. So this is anecdotal yet, because it's not, of course, marami. It's subject still for evaluation, but there is an initial great results of patients. You see, makikita doon sa mga mukha ng mga COVID patient, parang lumiligaya, gumagana ng pakiramdam, nagkakaroon sila ng ease of, nawawala yung loneliness and the anxiety are slowly being eliminated. So this is a great avenue, and they are using just a telekamusta, no? Telekamusta po yung i-kamusta yata ang telekamusta ang sabi nila. So this is somehow related with telemedicine. So as we wait for Dr. Ruiz to come back, as we have still a few minutes to interview him, and okay, so I think he's almost ready as he prepares for this presentation. Again, for those who are watching right now, for those who are tuned in, tomorrow we're going to have another presentation. This is going to be by Dr. Matthew Gilispe. It's all about minimally invasive using the biomimetic restorative approach. So it's a great avenue. He's been in the Philippines for the launch of biomimetic dentistry in Boracay, and ang ganda po ng lecture. And we're also very fortunate because Dental Marketing Philippines was able to invite him to do a webinar. So for those who have, tomorrow's webinar is going to be him doing a lot of presentation. He's gonna be doing it all by himself. No, I will just enter before and I will just enter after. So I think Dr. Ruiz is ready. So we have to bring him back. So as we are talking about, we have discussed many things about telemedicine, and Dr. Ruiz, you're back finally with us, and we're hoping that the audio is now clear so that we can provide more information very clearly to those who are watching right now. I would just like to say shout out to Miss Karen Villa. Thank you for watching. Don't hesitate to just share and ask question. Miss Amalia Postres, thank you very much, and Miss Purple Lani, thank you very much for really giving us information. And for those who are watching, just keep on asking questions while we have an opportunity and we have Dr. Ruiz with us. Okay, Dr. Ruiz, so if you may, can you please continue? And yeah, I think that's very clear now. Go ahead po. So you were saying about telemedicine, saan pa tayo naputol? So, e-prescription, Doc.
Yes. We can do the prescription or at present, yung ginagawa ngayon with this lockdown. A lot of doctors are doing telemedicine, an informal telemedicine. So, ibig sabihin, lahat halos, wala kasi nag-clinic. So, they will write the prescription, take pictures, and then send it to the drugstore. Yun ang pinapakita ng mga pasyente. But in the future, there must be proper e-prescription for that prescription. You can get it to the drugstores already. You don't need to get that and from the patient. In the US, the doctor can write prescription, and then the prescription will be directed to the drugstore. Hindi yan dala-dala ng pasyente. So, ang pasyente pagdating sa drugstore, nandun na kagad yung prescription. So, in the future, that's, I think, for the telemedicine, there will be e-prescription, wherein you don't need, it's a paperless. You don't need to paper. It will be sent directly to the drugstore. So that's the purpose. And even the medical certificate. For example, the medical certificate will be sent to your institute or to your so now we're doing a lot of procedures. So that's telemedicine.
Correct. So, as I was saying kanina, Doc, di ba PGH have initiated the e-Kamusta because there are a lot of patients who are COVID positive patients in PGH and they are not allowed to be visited by their parents or family and kamag-anak. So this is something like e-Kamusta. They use a laptop to communicate with the patients. And ang ganda daw ng resulta sa mga pasyente. Nagiging parang sumisigla yung COVID positive patients at nagkakaroon ng parang ng saya dahil nakausap niya yung kamag-anak. So this is something like parang ganun rin, no? Telemedicine, you consult with the doctors via online, you pay via online, the doctor write prescription, and you go to the drugstore and it will be honored by the pharmacy and they can give you gamot. Tama, Doc?
Yes. At present, the DOH allows telemedicine. Just like what I said before. There is no existing law that regulates telemedicine. But at present, being allowed. And I believe this will be the start of the telemedicine in the Philippines. Even the clinics, primary clinics, even your dental clinic, it's advantage for you to use telemedicine. Initial patients can do
Doc, if I may just go a little bit out of the topic, as you are general surgeon, you are a frontliner. What are some of the recommendations or advice that you can give us or those who are tuned in to rightfully protect themselves from from this pandemic or this COVID-19 virus? So just a
The
little bit
best,
out of the topic.
okay.
Okay.
The best
The best
protection
protection
is stay at
is stay
home,
at home.
exercise,
Exercise.
diet,
Diet.
take
Take
supplements.
supplements
People
that
are
people are
taking a lot
taking a
of
lot of
vitamin
vitamin
C
C
plus
plus
probiotics.
probiotics.
No?
No?
Combination,
Combination
vitamin C and
vitamin C and
probiotics,
probiotics
and some
and some
minerals,
minerals
plus
plus
exercise,
exercise
and
and
pray a lot.
pray a lot.
Yeah.
If
So
you eat, if you eat
If you
three
eat
times a
3 times a
day,
day,
pray three
pray
times a
3
day
times a day
also,
also.
that's a that's a
and be
that's
And
a
be
happy.
happy.
That's a very good advice from the point of view of doctors. So not only from not only but from the medical perspective. So we have to take a lot of supplements, vitamins, probiotics, minerals, etc. Plus, what about those who are already there? Those who are continuously serving. So those physicians, those nurses. How can we pump them up? How can we like give them support or what are the still ano ba nang pwede pa nilang gawin para palakasin pa yung kanilang sarili at loob, no? Sa from your perspective as the head of a certain
Pag,
different hospitals before.
pag
Pag
nakikita kasi
nakikita
namin
namin
na
na
ang mga
ang mga
tao
tao
ay sumusunod doon
sumusunod
sa
doon sa
social
social
distance,
distancing.
hindi sila
Hindi sila
sumusunod sa
sumusunod sa
quarantine,
quarantine.
hindi sila
Hindi sila
nagtitake
nagtitake
mask pag
pag
lumalabas ng
lumalabas ng
bahay.
bahay.
That's
That
demotivate sa
demotivate sa
front
front
office.
office.
Parang ano ba
Parang ano
to,
ba to?
nahirap kami
Nahirap kami
na
na
gamutin
gumutin
itong mga
itong mga
COVID.
COVID.
And then
And
these
then these
people
people
continuously
continuously
violate
violate
the
the
quarantine.
quarantine.
We
We
advise them
advise them
social
social
distancing
distancing
and face
and
mask.
face mask.
After this
After this
lockdown
lockdown
and
and
quarantine,
quarantine,
I believe
I
the
believe the
people should
people
continuously
continuously
practice social
practice social
distancing
distancing
and
and
the use
the use
of
of
wearing
wearing
masks.
mask.
No?
No?
You still
You
have
still
to
have to
wear mask.
wear mask.
Okay, so we will have Doc, we will have a new norms in life, no? So we will be more protected, we will be more cautious, and we will be we should we're going to protect each and every one, no? Not just us, but those who are also we are encountering on a regular daily basis. Tama po.
By
By
wearing
wearing
mask,
mask,
you
you
protect
protect
them,
them,
they
they
protect you
protect you
also.
also.
And just
And
like
just like
sabi mo nga, bagong norm,
bagong norm,
pati yung
pati yung
style,
style,
no?
no?
Siguro
Siguro,
dadami yung mga
dadami yung
style
mga
ng
style
mask,
ng mask.
no?
No?
And
And
magiging
magiging
normal sa
normal
atin
sa
ang
atin
pagsuot ng
yung
mask.
mask.
Doc, paano, ngayon, matanong kita, Doc, paano yung mga pasyente ngayon? Meron pa bang mga OPD open, yung outpatient department sa mga hospital? Kasi marami pong mga pasyente, just like we have several patients here, or we have several friends who are asking, naku, ayaw na namin pumunta ng hospital, eh, paano ako may sakit pa naman akong nararamdaman, now, and then they don't telemedicine yet, Doc. What is your advice on that?
Number
Number
one,
one,
ang
ang
PGH,
PGH,
merong medicine. No.
Ano po?
Number
Number
two,
two,
your
your
family
family
doctor,
doctor
no,
no,
should use
should
this
use this
telemedicine.
telemedicine.
And I
And I
believe
believe
some of them are using it
using it
to do medical
medical
consultation
consultation
to their
to the
regular
regular
patient.
patient.
No, even for
Even for
follow-up,
follow-up,
they're
they're
using
using
online
online
medical
medical
consultation.
consultation.
Number three,
Number three,
there's a
there's a
hotline
hotline
for
for
COVID.
COVID.
No, DOH is the
DOH at the
hotline. So you have to
you
call
have to
them,
call them,
tell them
tell
what
them what
your
your
signs
signs
and your
and your
symptoms,
symptoms,
and then
and
you will
then
be
you will be
directed
directed
or you
or
will be
you will be
referred
referred
accordingly.
accordingly.
So para
So para
hindi
hindi
nagsisiksikan kayo
kan
sa
kayo sa
hospital.
hospital.
Ay yung
Ay, yung
pagpunta niyo sa
pagpunta niyo sa
hospital, baka
hospital,
naman
baka
kayo
naman kayo
mahawa.
mahawa.
So talagang Doc ang physical distancing, because I call it physical distancing. Actually, I don't call
Yes.
it social distancing. But you advise that don't go to the hospital if you can coordinate, if you can talk to your family physician, that would be the first thing that you should do. Tama po.
Yes.
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 Okay. So as you said kanina, Doc, we are advising all of the televiewers, so all those are Facebook watchers to stay healthy, stay home, keep your vitamins checked, continuously do exercise and pray. And what other advices that you would be able to give us, especially, I think it's so uncertain because we now live in a 15 more days extensions in enhanced community quarantine, Doc. So we are on the final leg of our topic today.
Okay. To the medical professionals, or the health sectors, even the government, or the DOH, it's about time that we should pursue this telemedicine. We should be able to invest, no, to this technology. Make use of this technology. Telemedicine, uh, it will be used, no, by the government and even by the private sector. After this uncertain situation, this open up the opportunity for us to be able to invest actually in telemedicine. That's one big weapon for us. This is not the only pandemic. Another pandemic, that's another pandemic. Maybe after 5 years, 10 years. Now it is not the missiles or the nuclear bomb. No. We are now aware of that the greatest weapon now is this bacteria or virus. No. Baka nga hindi natin alam, no? Outside of the it is not the missiles, it is not this they will develop. No, there are some not bad people. Instead of using this bomb, they might use this viruses and bacteria. So the government, all the leaders should fully invest in this bioterrorism or pandemic or anything. A lot of research should be focused also on this medical.
Okay. So I think it's very clear that, as you were saying, this is not the only pandemic that we're going to encounter. Maybe not in our lifetime, or maybe soon, maybe in our lifetime. So you were saying, Doc, we have to prepare for this. It might not be virus that kills this virus. It might be bacteria that will kill this. So we just have to continuously be aware of that. And you wanted to really try to focus on helping the medical team to develop a certain medicine. Because, Doc, sinasabi nila ang COVID-19, I think 15 more months for us to be able to have a certain vaccine for it.
Yes. Hindi naman mawawala yan ng iglap lang. No, it will set it back 2 years. But what is important is after now we're trying to develop a medicine for virus, and then hopefully after 12 to 18 months we will be able to develop a vaccine for the virus. So yung vaccine hindi naman pwedeng 3 months, 4 months, 6 months nakagad yan. No? Even the medicine will have to undergo clinical trial, and it will take time. Minimum is 1 year, 2 years. So even the vaccine.
Ano pala? Okay. So, ayan. So, talagang kaya dapat mag-practice na tayo ng telemedicine. We have to, Doc, paano ba namin gagawin yan? For example, those who are, we do have our, I know I can do it, telemedicine, because you are my cousin. So, it's very easy for me. But for those who are watching right now, for those who doesn't have a cousin that they can connect, family doctor lang talaga, would you advise to connect with them in getting their, like, who will initiate? The patient or the doctor? Doc, pwede ba tayo mag-telemedicine? Something like that? Pwede ba yun?
Yes, both ways. Um, Disadvantage also. You can do your consultation. The doctors are staying at home. Those who are not the frontliner. They're frontliner per se because they're doing online consultation to their patients. Our doctors in our clinic are doing online consultation. So we're continuously serving our patients. They consult regularly through online. We set 9 o'clock up to 12 o'clock for them to do some face-to-face consultation through our laptop or computer. And then if there's a need for us to refer patient to the hospital, then we do so accordingly. So we sent, I think, a few patients already. We refer patient to the hospital for further diagnosis and treatment. But some we can do it through online. So we are continuously helping our patient.
Okay. So with that, Dr. Ruiz, I think I have discussed so many things about the COVID-19, telemedicine, how to stay healthy, and I'm giving you this opportunity for you to give us a final message for those who have listened, for those who have watched us, and you can still watch this replay, but you can still share. But Dr. Ruiz, would you like to give a final message for those who have watched for 1 hour and 1 minute to us? And just continue to be our guide as frontliners. Please, Doc, please.
Okay, to the health professionals, to my fellow doctors, those who are into giving service in the aspect of medical service, I think it's about time for us to be able to develop this telemedicine. It is not only for us, but for the country. For us to be able to serve also even to the remote areas, the far-flung areas of the country. It is about time that we should be able to develop, pursue, build infrastructure for telemedicine. Early prevention, early diagnosis and prevention is better than going to the hospital. So to our kababayan, stay at home, follow the quarantine, follow social distancing, use mask whenever you go out. Uh, this will help the frontliners, and this will help also the families. No, take have a good diet, vitamins, minerals, and probiotics. Uh, Eat, love, and pray, and exercise. Thank you very much.
So with that, Dr. Ruiz, we would like to we do appreciate the time that you spent for us for the Dental Marketing Philippines. Although you are not a dentist, but you're able to impart us from the medical perspective the need for us to have this kind of setup telemedicine,
Yes,
which is I think needed in the country today, especially during this time. So with that, we'd like to thank you on behalf of the Dental Marketing Philippines group and page, and to all the followers and viewers and subscribers of this page. We'd like to thank you, Doc. Thank you very much. Stay safe and stay healthy. Maraming salamat, Dr. Ruiz.
thank you very much.
So with that, we're able to get hold of Dr. Ruiz's presentation with regards to with regards to telemedicine. I think it is about time really to try to get this opportunity for us to really have this kind of a system na makakatulong po sa atin. As I'm sure all of the dentists who are listening right now, you are looking into teledentistry. I think let it be the organization and some other private sectors who would want to invest in here. Again, I would just like to invite each and every one of you to like the Dental Marketing Philippines page, as we're going to continuously give you more information, as tomorrow is another day for another learnings, as we are going to have no other than Dr. Matthew Gilispe. Now he's going to give us the presentation on an alternative approach to the traditional dental model using minimally invasive biomimetic restorative dentistry to build a value-based dental practice. That's going to be tomorrow at 10 a.m. And on the next day, we're still going to have Dr. Sonia Dunbar. This is for those who would want to practice geriatric. So we're going to talk about how to establish a successful geriatric mobile dental program. And on the 18th, we will have Mr. Arturo Pabia. You can ask anything about the whitening as he is the exclusive global distributor of these materials, and he'll be talking about cases and some other materials. And we will continuously give you more information as we go along with our lectures. I'm still arranging a lot of lectures for you. I'm still arranging a lot of presentation for you for free. So this is all for you. Again, I'm Roche P. Ruiz, MEA, Master Marketing, the founder of Dental Marketing Philippines. Maraming salamat po. I humbly thanks really to all the subscriber and those who are watching in Dental Marketing page. Please don't hesitate to share and just continues to ask questions. With that, maraming salamat po. Stay safe, stay home. God bless you all. Mabuhay po ang Dentistang Pilipino.